Benign breast disease is a spectrum of non-cancerous changes in the breast. These alterations can occur in the ducts and lobules of the breast, including lumps, cysts, sensitive nipples, and itching. The most common symptom reported by women is a painful, palpable mass or nipple discharge. Your non-proliferative breast lesions are not associated with an increased risk of breast cancer. These include simple breast cysts, papillary apocrine change, and mild hyperplasia of the usual type. Your proliferative breast lesions without atypia are disorders characterized by proliferation of ductal epithelium or stroma without cellular changes of abnormality. Next are your proliferative breast lesions with atypia. So these have cellular signs of abnormality. This is a high-risk benign lesion found in about 10% of biopsies. Studies indicate that women with atypical hyperplasia have an increased risk of breast cancer compared with women who have non-proliferative lesions. Breast issues are diagnosed from multiple approaches, including physical exams, mammograms, possible MRI, etc. Treatment for these conditions is relieving the symptoms. These women may have to reduce their consumption of caffeine and chocolate, since these can cause overstimulation. Reducing these may reduce the pain and nodularity. Also, time can heal. Given time, the cysts may disappear on their own. Breast cancer is the most common cause of cancer death among women and the most frequently diagnosed cancer among women in 140 of 184 countries worldwide. It now represents 1 in 4 of all cancers in women. Risk factors of breast cancer can be classified broadly as reproductive, hormonal, environmental, and familial. But let's look at the most common risk factors more specifically. 5 to 10% of breast cancers are linked to gene mutation passed through generations of families. The two most well-known are breast cancer gene 1, or BRCA1, and breast cancer gene 2, or BRCA2. Other factors include being female. It is 100 times more common in females versus males. Increased age. About 85% of cases occur in women over 50 years of age. And like we discussed earlier, history of breast conditions such as your atypical hyperplasia. Family history of breast or ovarian cancers in the first degree relatives such as your mother, sister, or daughter. Any radiation exposure to the chest. Being obese. Also estrogen exposure, which includes starting your period before the age of 12, starting menopause after the age of 55, women having their first child after the age of 30, women that never become pregnant, use of oral contraceptives, and women using hormone therapy that contains a combination of estrogen and progesterone. The majority of carcinomas of the breast occur in the upper outer quadrant. The first sign of breast cancer is usually a painless lump. This is important because remember we talked about the benign breast disease and their characteristics was a painful mass. Women should always be cautious of the following characteristics, including a breast lump or thickening that feels different from surrounding tissue, the change in size, shape, or appearance of the breast, changes to the skin over the breast such as dimpling, a newly inverted nipple, peeling, scaling, crusting, or flaking of the pigmented area of the skin surrounding the nipple or breast skin, and the redness or pitting of skin that resembles the skin of an orange. Substantial support for breast cancer awareness and research funding have helped create advances in the diagnosis and treatment of breast cancer. Breast cancer survival rates have increased, and the number of deaths associated with this disease is steadily declining, largely due to the factors such as earlier detection, a new personalized approach to treatment, and a better understanding of the disease. It's important for you to know the risk factors because they can help you identify women who might benefit from certain preventive strategies and to start teaching them the importance of self-breast examinations. And thank you. This concludes the breast disease and breast cancer discussion.